Need help billing in TherapyNotes? We can help. Medical Billing Professionals is an approved TherapyNotes billing partner. Do you have to use TherapyNotes to use our mental health billing service? It's important to stress providers do not have to be using TherapyNotes or any EMR in order to use our mental health billing service. We have easy online forms providers can complete to provide patient demographics or billing. In addition, we can work with other EMRs like Simple Practice, Valent, Iconotes, and Practice Fusion. If you are using any other EMRs, you can export patient demographics and billing to provide to us. Now, not all practices require the same level of service. Providers should only pay for those services that they need. Therefore, for TherapyNotes users, we offer two different levels of service, Platinum and Premium Plus. With the Platinum service, we can handle all billing responsibilities in TherapyNotes. We can set up new patients in TherapyNotes, verify insurance benefits. For new patients or for patients who change insurance, we can submit the claims, post payments, follow up on denied claims, and provide a revenue report upon request. For setting up new patients in TherapyNotes, the biggest problem with rejected claims is not setting up the patients correctly. For example, maybe you entered the wrong insurance payer or the wrong ID number. For any new patients, you have three options if using our service. You can set up all new patients yourself in TherapyNotes. If you are using the patient portal in TherapyNotes, on a daily basis, we can download the client insurance form completed by your patients. Or you can complete a simple, secure, online form on our website. We then will accurately set up the patient in TherapyNotes. If you choose the third option, you can still set up the patient with basic demographics such as name and date of birth, so you can schedule the patient. It is highly recommended that you upload a scanned copy, front and back, of the patient's insurance card into TherapyNotes. For verifying insurance benefits for any new patients or for patients who change insurance, we will verify eligibility and benefits if enrolled with our Platinum service. If enrolled under our Premium Plus service, this service is optional. We will enter the information on the Billing Settings tab for the patient. The information entered will include the effective date of the coverage, any deductible, including amount remaining, any copayment or coinsurance, any out-of-pocket max, including amount remaining. If claims go to a third-party payer, like Carelon Behavioral Health or Magellan, if prior authorization or a referral is required. If you need to know if a specific CPT code is covered, such as 90847 or site testing codes, let us know in advance. Benefit information is entered in TherapyNotes generally by the next business day. There is a limit of 3 verifications per day and 60 per billing month for our Platinum service providers. If you exceed 60 during a billing month, there's a fee of $11.95 for each additional verification. We also do offer an optional service for existing patients with the same insurance since the last visit. We can verify benefits for $11.95 per verification. This service is designed primarily to see if a patient's benefits have changed for a new benefit year, or if a patient has met his or her deductible or out-of-pocket max for the year. On a daily basis, we will log into your TherapyNotes account and submit your claims ready to submit electronic and paper. We will review any claims that may have rejected electronically. If we are able to determine the reason for the rejection, we will correct and resubmit. If we require your assistance, such as a claim denied because the patient's coverage terminated, we will securely notify you of this so you can provide us corrected information. For EAP billing, we are able to submit those claims to payers that allow electronic submission, such as United, Optum, and Cigna. For payers like Magellan or Carelon that require EAP claims to be submitted via their specific online forms, providers will submit these forms themselves because of the requirement for clinical information. We do recommend that we set up United and Cigna as separate EAP payers on your payer list because of the payer-specific requirements for EAP billing. Now, as of right now, TherapyNotes does not offer the option to submit secondary claims electronically. Although this is coming soon, it is in beta testing with TherapyNotes. If a patient has secondary insurance that is not automatically crossed over by the primary payer, right now you have to print the secondary claim in TherapyNotes, attach the primary payer EOB, and mail to the secondary payer. However, we do offer the ability to submit secondary claims electronically to most payers via our other practice management program. This results in faster secondary payments to you and fewer claim rejections. For payment posting, we will ensure your office is enrolled with all possible payers to receive electronic remittance advice, electronic EOBs, and TherapyNotes. On a daily basis, when we log into your TherapyNotes account, we will post all ERA files, but prior to posting, we will review the ERA for any claims that denied. For claims that may have denied in error, or where we cannot determine why the claim denied, we will automatically follow up with the payer. For claims that denied because coverage terminated or eligibility was not found, we will notify you to provide us corrected or updated insurance information so we can resubmit. For any EOBs you receive in the mail, you will scan the EOBs you receive that are not also found under ERA and TherapyNotes and securely upload them to our website. We will then manually post those EOBs in TherapyNotes. For payers that offer ERAs through another platform but are not available for TherapyNotes to receive, we will download those EOBs from the other platform and upload them into TherapyNotes and then post the ERA. For payments by your patients, you can easily post those patient payments yourself in TherapyNotes. Assuming your office is enrolled for our Platinum service, follow-up of outstanding or denied claims that we have submitted is included in this level of service. When we post EOBs from payers, if a claim rejects in error, or we cannot determine from the EOB why the claim rejected, we will automatically follow up with the payer. For any claims that remain outstanding more than 30 days after claim submission, we will automatically follow up with the payer. If, after speaking with the payer, we require additional information from you, such as notes or corrected patient demographics, we will securely notify you. At least once a week, and preferably every day, your office must provide us copies of EOBs you receive that are not found in TherapyNotes under ERAs. Do you pay your clinicians a percentage of the amount paid by insurance? If so, you are probably using the revenue report in TherapyNotes. Upon request, we can provide you the revenue report upon the schedule you set. But are you aware the revenue report is based upon the date of the payment? This can cause problems. For example, if on Saturday the 15th, we run a report for the week that ends on Friday the 14th, and then on Monday the 17th, we post a payment from a payer with a payment date of Friday the 14th, that payment is lost for revenue report purposes. However, if we know you will be wanting us to run the revenue report, the way we get around this is by changing the payment date. In the above example, for the payment received on Monday the 17th, to ensure that payment is reflected on the next revenue report, we would change the payment date when posting in TherapyNotes from Friday the 14th to Monday the 17th. Now, our Premium Plus service allows you to save. We set up new patients in TherapyNotes. On a daily basis, we review and submit all claims. We submit all secondary claims. We review and post all EOBs. We provide the revenue report per clinician upon request. Verification of benefits is optional, and follow-up is optional also with our on-demand follow-up service. We do notify you of all claims that deny in error and require follow-up. For the Platinum service, there is no setup fee. The standard per claim rate is $3.99 per claim with a minimum fee of $199.95 per month. A 1,000 claim annual prepayment option is $3.65 per claim. A 2,000 claim annual prepayment option is $3.35 per claim. With the annual prepayment option, the number of claims purchased must be used within 1 year. For the Premium Plus service, the standard rate is $2.89 per claim with a minimum fee of $99.95 per month. 1,000 claim annual prepayment option is $2.59 per claim. A 2,500 claim annual prepayment option is $2.19 per claim. Again, the annual prepayment option requires that the number of claims purchased must be used within 1 year, and there is no setup fee. Are you using a billing service charging a percentage? If so, you are probably overpaying. Most billing services charge between 5 to 10% of the amount paid, with the average being 7%. If you are paying 7% and your average reimbursement is $80 per visit, you are paying $5.60 per claim compared to our highest fee of $3.99 per claim. If your average reimbursement per visit is more than $80, you save even more with MBPros. For example, if your average reimbursement is $120 per visit and you are paying 7% to another billing service, you would pay $8.40 per visit. Now, some providers do multiple notes for a patient at one time rather than doing notes each day. If so, you might be able to save because we might be able to get more than one visit for a patient on a claim. So let's say that every 2 weeks you do notes, and so you might have 2 visits for John Smith. Those can go on one claim. You might get reimbursed $80 per visit for those 2 claims, those 2 dates of service, I should say. So that's a total of $160. If you paid another billing service, you pay $11.20 for those 2 visits. With us, again, the maximum is $3.99 per claim. A billing service charging a percentage will argue they fight hard to get your claims paid. In reality, follow-up is needed on only 2 to 3% of behavioral health claims. If you submit 100 claims during the month, you would be overpaying on the 97 to 98 claims that are processed without any need for follow-up. And we have a form on our website. Go to mbpros.com/save. There's an interactive form where you can calculate how much you can save by switching to MBPros. Now, we do have an introductory special offer. If you choose our standard per claim rate, you will receive 2 months free. It's a limit of 100 free claims per month if we are doing all of your billing inside of TherapyNotes. Then you will save 10% for the first year. So if you choose our Premium Plus service, you pay only $2.61 per claim. If you choose our Platinum service, you pay only $3.59 per claim. If you have a smaller practice, you also save 10% off the minimum monthly fees. So it would be $179.95 per month after the first 2 months free. For the Platinum service, for the Premium Plus service, the minimum fee after the first 2 months free is only $89.95 per month. If you want to prepay and purchase a prepayment at the very beginning, you do receive 2 months free. You also save 20% for all prepayment purchases for the first 5 years. So, for example, for the Premium Plus service, purchase 1,000 claims for $2.07 a claim, purchase 2,500 claims for $1.75 per claim. For our full service, for the Platinum service, a 1,000 claim prepayment is only $2.92 per claim. So if you purchase an annual prepayment option at the very beginning and you continue purchasing prepayment options for the next 5 years, you know you will be paying only $2.92 per claim. If you're submitting on average 40 or more claims per week, you could purchase 2,000 claims for only $2.68 per claim. And again, you can count on that for the first 5 years of using our service. Now, again, with an annual prepayment option, the number of claims purchased must be used within 1 year, but the 1 year time period does not start until after the 2 months free. There's another way you can save by switching to us. Register for our Platinum service with our standard per claim rate. After 12 months of continuous service, you will receive a credit with us equal to 4 months of TherapyNotes base fees for the first clinician in a group, a total of $276. If you purchase a prepayment option at the very beginning, after 12 months of continuous service, you actually will receive a credit equal to 12 months of TherapyNotes base fees for the first clinician in a group for $828. Now, the credits are non-refundable. They can only be used for future invoices with MBPros. If you cancel service within the first 12 months after completing our Getting Started form, there is no credit provided. And this offer does expire December 31st, 2025. For more information, visit mbpros.com/TN2025. You can email us at info@mbpros.com. If you want to meet virtually, one-on-one, pressure-free, just go to mbpros.com/virtual to schedule your meeting. Again, if you want to see how much you can save by switching to us from a billing service charging a percentage, go to mbpros.com/save, or you can call us 877-762-7767. Thank you.